Hello, my name is Sarah Oakley. I'm a nurse, health visitor and international board certified lactation consultant and tongue-tie practitioner, and also author of the book Why Tongue-Tie Matters. I'm going to talk today about some of the emotional impact of having a baby with tongue tie, because this issue isn't just about getting a baby fed and getting milk into a baby. A lot of the families that I meet have had quite a difficult and turbulent journey before they get to me. They found it very difficult to get people to listen to their concerns about their baby's feeding. And when those concerns have been listened to, sometimes they've been dismissed. Often there's lots of misconceptions around tongue tie. If the baby's gaining weight, it's seen not to be an issue. If the mum hasn't got sore nipples, it's seen not to be an issue. But tongue ties can affect babies in lots of different ways and can have a negative impact on the mother's experience of breastfeeding or indeed bottle feeding her baby. And just getting listened to can be quite a challenge, and actually finding the right person to listen to you and take on board the concerns you have can be quite tricky and difficult. Getting a diagnosis of tongue tie isn't easy because it's not part of the regular training of doctors, GPs, paediatricians, midwives, health visitors, nurses. It's a specialist training, and very few healthcare professionals actually have the competency in tongue tie assessment. So the person you're talking to may not necessarily have the skills to be able to make the assessment and diagnosis. So that may then mean you're referred on to another service with another practitioner, and there may well be delays in getting the answers that you're seeking. Having got an answer and got a diagnosis, there's then the question of who's going to do the division. And that again can involve referrals and delays. Some services are set up so that the person who does the assessment can actually also divide. But very often, the person doing the assessment in the community then has to refer you into a hospital situation to get a division performed. So there can be quite a lot of delays with that, especially at the moment. And then there's the whole issue of how do you manage the feeding while you're waiting for the tongue tie division and getting support around that. And in some areas, there's lots of breastfeeding support groups and lots of skilled support around. And in other areas, that's much harder to access. And trying to keep the feeding manageable and sustainable while you're waiting can be very emotionally draining and debilitating. And for some parents, it's going to be way too much for them, totally understandably, because there's nothing worse than being in pain every time you feed, or watching your baby struggle with wind and reflux, or actually weighing your baby and finding out that despite your efforts and despite feeding them 10 hours a day, their weight gain still isn't quite where it should be. So having got to the stage of having treatment and actually having got a diagnosis, there can be a huge sense of relief. But then once the baby has the tongue tie division done, there can be further issues. For some babies, having the division done is going to lead to a very quick and swift improvement in feeding, but that isn't always the case. And if this issue has been dragging on for a long time, you may be in a situation where you're having to use lots of top-ups, do lots of expressing, use lots of formula, and that often needs to continue for a period after the tongue tie has been divided. And this can all be very demoralising. And some babies do take a good week to 2 weeks to start to show significant improvements in the way they're latching and in the efficiency of their feeding. And it can be quite difficult to keep continuing once that division is done, because your expectation and your hopes are that you're going to see a quick fix, and it isn't always a quick fix. So again, getting the right help and support during that period is crucial. And I do find some mums that it's taken so long to get to the point of treatment that once the division is done, if there isn't a fairly rapid improvement, they just can't continue. They are emotionally burnt out and they just can't continue, and they end up switching over to formula when that isn't what they would have wanted to do or what they plan to do. But it is totally understandable. It can be quite traumatizing, and I often see families who've had a baby with tongue tie who then go on to have further babies, and they contact me in pregnancy to prepare for the next baby because they are so scared that they're going to have a similar experience, and they want to try and avoid that. So if you have had a tongue tie baby before, it's always worth making sure you've got the right support and the right people with the right skills in place prior to giving birth, so that you can get the right support very early on afterwards and hopefully head off a lot of the trauma and problems you've experienced with the first one. Often feeding doesn't go as planned with a tongue-tied baby, and you may end up doing things like topping up, using bottles, expressing, using formula, using dummies, all kinds of things that you didn't anticipate you would have to do when you first started breastfeeding your baby. And your goal may have been to exclusively breastfeed for 6 months and to continue to breastfeed until your baby was ready to wean. But the problems caused by the tongue tie may mean a readjustment of those goals. And with a readjustment of those goals can come a lot of grief and loss, and that needs to be acknowledged. And you need support through that. And it's perfectly okay to say that you feel sad that things haven't worked out how they were. It's very, very often people try to tell us that it's fine, as long as the baby's fed, it doesn't matter. But it does matter. It matters very much that you've not been able to succeed with your goals. But sometimes readjusting and accepting that maybe you will have to combination feed your baby either with express milk or formula can be helpful, because it can mean that you can sustain breastfeeding for longer. And feeding isn't an all or nothing thing. Breastfeeding comes in lots of different forms. For some women it will be exclusive breastfeeding, for others it will be a combination of express milk and breastfeeding. For others, it will be a combination of formula, breastfeeding and express milk. For some mums, it will involve the use of donor milk. For some mums, it will involve using things like supplementary nursing systems. There's all sorts of different ways that babies can receive breast milk. It doesn't have to be through direct breastfeeding. And valuing that, in all its forms is really important. I think as a culture, we tend not to value breast milk and breastfeeding very highly, and that's why mums struggle to get the support they need. Mums often feel that they haven't achieved breastfeeding if they end up having to use some formula or having to top up with express milk or having to bottle feed breast milk fully. A lot of the mums I see end up doing a lot of their breast milk feeding via a bottle, and that's absolutely fine. Breastfeeding isn't an all or nothing thing, and it doesn't have to be exclusive breastfeeding or formula feeding by bottle. There's lots of combinations of feeding that can go on in between that. And the longer your baby gets breast milk, the longer they get the benefits of the breast milk. So it's often looking at, ways of sustaining at least some breastfeeding rather than looking at, exclusive breastfeeding. And if I can't do that, well, I'm going to formula feed. And so it's worth talking to your breastfeeding counsellor or your lactation consultant about, different ways that you can manage the feeding to make it sustainable and to achieve, goals that may be adjusted from your original goal, but, are still worthwhile and very valid goals and things to do. One of my colleagues recently posted a post on Facebook, which basically expressed a sentiment that lots of mums expressed to me, where they ask me, am I selfish to continue to pursue breastfeeding when breastfeeding is really challenging? And no, you are not selfish. There's nothing less selfish than trying to breastfeed your baby and trying to give your baby as much breast milk as possible. So I always remember that. So tongue tie can present many challenges, and sometimes that involves a reevaluation of our goals and expectations. But the key is to find what's right for you and what's comfortable for you and what's right for your baby, and get the support so that you can achieve whatever goals you've set yourself.